record and quick screen share. Alrighty. So in week one of our onboarding, what we went over was basic charting. Week two, you spent with Shelly and she went over some basic marketing stuff. Week three, we're going to bring it back to MFL. We're going to go over some education for both microneedling and for chemical peels, and also how to do some charting. Okay, the very first thing that we want to go over is whenever you get a brand new bottle or opened bottle of product, it's going to come exactly like this. So it will come from the manufacturer, obviously in the box if it's a brand new box. And then it will also have a My Face Lady sticker that we put on top of the box. The purpose of this is so we know who actually reconstituted it, the date that it was reconstituted, and the reconstitution just know the approved ways to reconstitute for MFL are Botox. You can do 1:1 or 2.5, Daxify 2.5. Dysport can be 1.5 or 3. We do ask that if you are not comfortable with doing those other reconstitutions, that you I'm sorry, if you do use the off-label reconstitutions, that you use the entire bottle and you don't offload it to a novice injector because not everyone is comfortable doing those different reconstitutions. Okay, so what we're going to go over is we're going to go over how you do the promotions and the wallet within Aesthetic Record. Now, promotions are internal things that MFL will do as far as different sales that we'll have going on. It'll be like the Talks Wednesday or Bring a Friend promo or anything like that. And then the wallet is used for specifically our VIP and for our alley patients. Whenever someone is a VIP member, they automatically get all of their funds that they get from their membership automatically get deposited into their AR wallet. And then that can be used just as normal money. The other way is for all of our Alley patients who use Alley. We will actually go and collect the funds on the Alley website, and then we will have to digitally put them in on the patient's virtual wallet so we can use it on the other side. So let's go through these real fast. So after you have charted on the patient, you're going to go ahead and click checkout. And you can actually take your finger and pull your finger down and it will slide down where it says current sale. So that way you can see everything that is going on. You're going to go on over. You have the promotions and the wallet and the products tab up top. I'm currently clicked on the promotions tab. And so you can see all the different promotions that we have. Once you have a promotion that you want to do, you simply just click on it and then it will automatically apply it. If you accidentally click on one, just simply click on it again and it will undo it. Now, for the wallet, if the patient is an Aspire member, they will automatically have their points kind of register in the back, and you can do everything from AR. That AR is fully integrated with Aspire, which is fantastic. It makes it super easy. So you'll be able to see any points that we can utilize there or any additional specials that they have. So for this particular patient, they got Dysport. So I'm going to click on the Aspire promotions and the 600 points, which equates to $60 off. I then will click $60 and then click send code. It will automatically send a text to your patient with a special code that you will type in there and it will verify it. So then whenever you go to checkout, what you will do is when you click on AR wallet, so I'm actually going to go back to the screen. So after you click checkout, you will then click on the type and it will be on, you will click on AR wallet. That's where those funds will be put. So you have card, cash, AR wallet, Cherry, Klarna, Care Credit, all of those things. You will click on AR wallet and any funds that are in there, you'll be able to subtract from there. So for this particular patient, there are $10 in there. You click on charge and it will automatically subtract $10 from the patient's bill. Super easy. Now, what I'm showing you here, this is how you add money to a patient's wallet. So if you have to go in and add it for Allie, or if a patient accidentally tips and you want to add the money to their wallet, you can do it this way as well. So I'm going to show you where you go from that. So I'm going to back up just a smidge. So whenever you click on, when you click on the patient, you're going to click on that little, the three blue dots in the upper right-hand corner, and you're going to click on wallet. Once you click on wallet, you then have the ability to go ahead and add money from here. I always suggest just clicking on dollar credit instead of the individual Ally or any of the other ones. It makes it super simple. You obviously can click on the Ally points. I always just do it underneath the dollar just to make it simple though. And you're going to take your finger and you're going to slide it over and you'll click add. And I'm adding the amount.
At that point, how do you know how much is the amount?
For Ally.
Yeah, so that's coming from the code that they get.
No, so Ally is with Botox. So that's the only time you have to do that. So Aspire, you don't have to do anything with that. It's just automatically does it. But Ally is not integrated with an aesthetic record. So the majority of the other ones are not. So the patient will know how many points they have because they will have an app from Ally.
Okay, so they'll have to pull it up on their
Yes.
end. Okay,
Correct. Yep. So what will happen is the patient will say, "Oh, I have $20 on my app." And you'll say, "Great, let me see it." And you'll look at it and you'll say, "Great." You'll add it and then you'll have to go into the Ally account and actually log those points. And there's a whole nother kind of video and graphic on how to do that because that's actually how the company gets reimbursed back for it.
got it. Thank you.
Yep. So very simple. That's how you add it. Okay, let's talk about the difference between an enhancement and a finesse. So, a enhancement is for a patient that's, let's say that they go in and they say, I want to get my glabella done. And they say, oh, and you're like, okay, great. It's going to be 20 units of Daxxify or 20 units of Botox or 50 units of Dysport. And, just for for full dosing. And they say, oh, I really can't do that right now just because of budgetary concerns. I can only do half. Great, we will just do half. If the patient comes back to us 2 weeks later and says, I'm still not frozen, I need more, the patient at that point will have to pay for those additional units. It's just because they elected to not get full dosing because of budgetary concerns in the very beginning. If that original 20 or 10 units works for them because they only want to do half dosing, that's fantastic, but we can't add the additional units for free. Now, let's say the patient does exactly what they were supposed to do and what you recommend, and then they have a little spot guy or drop brow. That's called a finesse. That is completely free to the patient. That is up to 4 units of Botox and up to 10 units of Dysport. Remember, 10 equals 4. And again, those are for little accidental spot eyes or brow drops. It is not for a new area. So if the patient's like, hey, I want to get my lip flip done now, that is not what the purpose of that is for. Okay, let's talk about employee discounts. Discount as an employee, you get 55% off of all of your personal treatments. What it will look like is whenever you go and click employee discount, you'll automatically choose employee discount or self-injection, and it will automatically decrease by 38%. Then you get paid your 17%, so it equals a total of 55% off. Oh. There we go. Okay, so we're going to do a quick frontalis review. Okay, so for the frontalis, remember you have large and kind of small foreheads, and depending on how large or small the patient's forehead is, that will determine how much product that you actually have to use. How we mark the patient will determine their unique anatomy, but I do give you a basic foundation of what to work with. And then obviously you want to try to learn the face or read the wrinkles like a book. Where there's a wrinkle, that's where you're going to be injecting, but again, just kind of give you this base knowledge. So how you're going to be doing this is you're going to go from the lateral canthus straight up for a large forehead, medial canthus straight up, medial canthus straight up, lateral canthus straight up. If they do have a large forehead, you're then going to do an additional layer up top, and this would be pupil straight up, nose straight up, pupil straight up. Again, you might have to tweak that depending on the patient's unique anatomy. Okay, we're going to play a quick little fun game. You're going to tell me if it is a large or small forehead. What is this patient right here?
Large.
Very good. Large forehead. This is exactly how I inject this patient. She's been one of my patients for years. What about this patient? Large or small?
Large.
Very large, right? She also has a little bit of a rainbow on the side as well. So you can see I will hit her little rainbows. The little rainbow is this little arch right here. It's caused from abicularis oculi, where it kind of meets the frontalis muscle and it forms this little ridge. So you can knock it out with 2.5 of. Someone just opened my door. A second. No. Nope. Nope. Sorry, my pig just came inside. Okay, what about this patient, large or small?
Small.
So she is actually a large forehead, and she also has a rainbow on one side, which is neat. So you're like, as you start to kind of progress, you're going to start to learn like, okay, well, let me really look at the patient and see where if I need to like move these injection points. What about this patient?
Small.
Yeah, she's a smaller forehead, right? Very good. Okay, moving on. Okay, we're going to watch a quick little video of an eyebrow lift. In the eyebrow lift, what the muscle that we are treating is actually going to be abicularis oculi. The muscle does extend all the way kind of up into the eyebrow and into the eyelid. So whenever we do these eyebrow lifts, we are injecting the abicularis oculi. Remember that it is a natural depressor tox elevator. So whenever we put neurotoxin into it, it forces it to do the exact opposite. So we're going to watch a quick little video from one of my favorite instructors, and this is Dr. Tim Pierce.
I recently posted a video on how to do a brow lift, and many of you asked questions on how I was able to inject underneath the eyebrow and not cause an eyelid ptosis. Now, unpacking this is a very interesting way of understanding the anatomy because, of course, we are all very afraid of causing eyelid ptosis. Now, many years ago, when I first started training, I remember training an ophthalmologist who told me that they injected the eyelid close to where I was just warning my trainees to be careful of injecting. And they used 4 units, so 4 times more than I would normally use, and he'd never had an eyelid ptosis. And this really got me thinking much more about the anatomy. So by the end of the show, if you watch it all, you should understand the nuances of different muscles and how they are differently affected to what you may have first thought when you first learned how to inject Botox in this area. So many people were concerned that my injection points were so close to the eyelid that I may cause an eyelid drop. Now let's first consider.
Some moms want to build income from home. They just don't want to post, pitch, or be online all the time. That's exactly why Amazon Zero is catching on. Zero social media, zero shipping, zero tech headaches. Carla, show them what they've been missing.
Busy women are pocketing cash using Amazon's Kindle app and tapping in.
What actually happens if you inject the eyelid? So people have purposefully injected the eyelid with toxin. And you'll be surprised to find out, if you didn't know this already, that what will actually happen is your eyelid will actually lift. And that is because the superficial muscles that are in the eyelid are actually the protractors of the eyelid. They are not the retractors. So the retractor muscle is the levator pulpibri muscle, which runs in the orbit. And this is what we are concerned about not injecting. Whereas the orbicularis oculi, which actually runs in the eyelid, if you inject that, actually allows your eyelid to open slightly, because when you close your eyes, it's contracting, you relax it, it actually opens. So it's actually the reverse of what many people think, because they haven't thought about where the muscle that lifts the eyelid actually lives, which is in your orbit. So understanding this is the first thing around why you don't need to worry too much around eyelid ptosis. But there are other elements too, because of course we can get eyelid ptosis from injecting superior to the eye. So we need to think about what injections are likely to be causing that and what we can do to avoid it, and why my style of injection in my career has never caused an eyelid ptosis in any of my patients. So that's part one of what to understand. We need to think about which muscles are likely to be involved and what injecting toxin actually does to them. If you're injecting superficially and you inject orbicularis oculi, you will find the eyelids actually more likely to lift. In fact, it's now a treatment for eyelid ptosis when you've injected the other muscle, the levator pulpary muscle. Knowing precisely where these muscles are and what layer they're in will give you confidence to inject in areas where other less thought out clinicians will think you're going to get an eyelid ptosis. So let's think about the layers in this area. Obviously at the top you have the dermis, then you have a thin layer of fat in the hypodermis, and then you have the orbicularis oculi muscle. Underneath that there's the retroorbicularis oculi fat pad, then you have the orbital septum, and underneath that you have the preseptal fat pads, and underneath that, you have the levator pulpary muscle. So there are actually multiple layers. So to help you understand this, let's think about the face and the anatomy in this area, not with all the difficult medical terms, but just as a sandwich. Imagine that you're having a sandwich on your mum's favorite tablecloth. That represents the most precious part of the anatomy, the orbit. We don't want to get ketchup on the precious tablecloth. And of course, if you make your sandwich directly on the tablecloth, you're going to make a huge mess and cause your mum a lot of upset. Or your dad. Might be dad's favorite tablecloth too. But what we actually do in real life is you have layers that protect that tablecloth. We have a placemat on top of that. You could think of the placemat as the preseptal fat pads. And on top of that, you have the plate, which you can think of as the orbital membrane. On top of that, you have your first layer of bread, which is the retroorbicularis oculi fat pad. On top of that, you may have the meat, the muscle. On top of that is where we try and put our ketchup. And one layer on top of that is the dermis. So actually, the ketchup is shielded from the tablecloth by multiple different layers. And it's exactly like that with injecting botulinum toxin. We're actually injecting tiny amounts just on top of the muscle, and we have multiple other layers shielding those important structures in the orbit. And it's the depth of injection rather than the position relative to the eyelid that keeps those internal structures safe. Another question that we got many times was, how many units do I like to place in the dots underneath the eyebrow? I find it really helpful using just a 1 unit dose, and this is enough to get a difference. I'm not necessarily trying to paralyze the bulk of the muscle. I just want to affect those fibers that are pulling the eyebrow down. This is also a safer amount. It's a bit like, to go back to our analogy, like using less ketchup. You're just less likely to get an inadvertent mess. So small amounts, wherever you can use them, are always safer. As a general rule of thumb, the dose response curve is less likely to cause you a problem. So that's why I use 1 unit. I typically use 1 to 3 units underneath the brow, and then I'll use my stronger doses where the licensed dose is higher at the lateral canthus. In terms of dilution, I usually use the standard dilution of 2.5 mils in 100 units of botulinum toxin, but sometimes I'll use a more concentrated form if I'm in an area where I just want to make sure there's less chance of a spread. But I used to do that a lot more than I do these days. I've had so few complications that I very rarely use different doses. When I do use the more concentrated version, it's in the lower face. Injecting the depressor angularis oris or the mentalis, I feel safer using a more concentrated dose. For most of the rest of the face, I dilute 100 units with 2.5 mils of bacteriostatic saline. Another question we got was, does the brow lift occur from injecting below the eyebrow or also from injecting above the eyebrow? And in fact, years ago, I had patients who would come and say, no, I've had an eyebrow lift, the doctor injected here, you have to do the same in order to get a lift. Now, if you think about the anatomy, this cannot be true because these are the elevators. And if you inject the elevator of the eyebrow, you're going to decrease the power of that muscle to lift. So you're actually more likely to get a drop. And in fact, most of us are very afraid of injecting directly above the eyebrow in the frontalis muscle because that is where you lose the eyebrow arch. So you only get a lift when you affect the little tug of war that's going on with the eyebrow between the two muscles. One's an elevator, one's a depressor. So if we weaken the depressor, which is the orbicularis oculi muscle, and you can see this because if you want to lower your eyebrow, shut your eyes very tightly and you will see your eyebrow comes down, and that's caused by orbicularis oculi. And the frontalis muscle does the opposite. So the tug of war is won by reducing the strength of the depressor, which is orbicularis oculi, not by treating the frontalis muscle above it. However, the other way we create eyebrow lifts is by increasing the resting tone of the lateral frontalis muscle. And this is done when we treat the middle of the frontalis and the lateral gets more active. So in some of my videos, you'll see that I draw cat ears, we call them, and I tell injectors generally not to inject in those cat ears. Now, those cat ears represent the elevating part of the frontalis muscle. So it's when I say that it reduces the chance of a ptosis, I'm talking about a brow ptosis, not an eyelid ptosis. And this is one of the biggest confusions that happens earlier on for people, is differentiating between a drop in the eyebrow and a drop in the eyelid. And nearly all of the cases I get sent are actually drops in the eyebrow, not in the eyelid. The actual eyelid is stable, but it's rested on by a heavy eyebrow. Typically, if they have extra fat above their eyes and that's resting, or they have an eyelid shape that just naturally transmits energy into the eyelid, it confuses injectors. But that is all to do with reducing the strength of the frontalis muscle in this crucial area that elevates your eyebrow laterally. So the more botulinum toxin that you place in this area, the more likely you're going to have that problem. And so particularly in females and not so much in males, I don't treat that area because I want there to be an eyebrow arch. Females also tend to use their eyebrows in a different way to men, which is to do with applying makeup. Every morning, if you apply makeup, you tend to lift your eyebrows up, whereas men do not notice the loss of movement laterally. So you can actually treat men quite often with more Botox in the cat ear and weaken the frontalis muscle all the way across, and it does not cause any problem or concern at all, whereas a female will miss that ability to raise their eyebrows and apply makeup. Other injectors were concerned by not treating the cat ear area that you may then cause a Spock brow. And in fact, this could be part of a Spock brow. Typically, I think of a Spock brow as a medial brow ptosis and a lateral brow lift. So if you overtreat the middle and undertreat the side, then absolutely you get this disequilibrium, and you have too much activity and too much heaviness in the middle, and that creates this unpleasant shape. So it is possible that you could be on that spectrum. Like everything we do, you're trying to make the adjustments to get a happy medium. So I want a little bit of a brow lift, not a huge one, and I adjust that sometimes by putting one unit in the top of that triangle of the cat ear, and that's typically what I'll do when I know the patient or when I'm confident that they have quite a strong frontalis. I will treat within the cat ear area. I think sometimes people see these markings and they think it's a definite no-go area. It's actually not. It's just an area that I'm more cautious of injecting, and it's helpful if you know you're creating an eyebrow lift, and if you don't know the patient, to start with leaving it undertreated and then to treat them at a follow-up and then make a note of where that treatment was. So then you have a plan that will work each time you see them. But the first time you treat someone, particularly if they're a little bit older and brow drops a little bit more likely, it just makes sense to see what happens with those units, get the result back in 2 weeks, and then make an adjustment, learn from it, and then you can repeat safely whatever you learn from that patient in the first course of treatment. So I hope that's helped you understand in more detail the three important muscles, particularly with respect to eyelid drops. So we've got the levator pulpary muscle, the orbicularis oculi muscle, and the frontalis muscle. And if you take away anything from this, it's the three-dimensional injection depth that matters most in terms of safe injecting around the eye.
All right. Okay, let's move on to the next one. Do y'all have any questions about an eyebrow lift?
No, I'm good.
Perfect. Sometimes I'll also do an eyebrow lift automatically when a patient is naturally pretty hooded. Like I'm a pretty hooded person. So I do 1 to 2 spots on my lateral tail, or 1 centimeter in, or both sometimes, depending on how much of a lift I want. All right. I told y'all this is going to be a long night of videos. We're going to go over bunny lines. This one is not as long. Remember the bunny lines, it's caused from nasalis. I also like to treat it like a small muscle group. This is one of the only injections that I do while the patient is contracting, because that way it gives me a little bit more meat to work with. So we're going to watch a quick little video.
One, two, three. So I I'm just doing 1.5 units each side.
Short and sweet. Any questions on nasalis? Excellent. Okay. The next thing that we're going to go over is microneedling. There is a video that we need to watch from MD Needle Pen, and it is from the manufacturer.
Rent a car from our newest fleet yet. Your real car never has to know.
What is microneedling with the MD Needle Pen? Microneedling, also known as collagen induction therapy, stimulates the body's natural healing process by creating microchannels on the surface of the skin. This procedure leaves the top layer of the skin intact, allowing for shorter healing time and the ability to treat many different skin concerns. Each microchannel allows for the absorption of serums, hyaluronic acid, and PRP when used during the treatment. The body is stimulated to fill these microchannels by producing collagen and elastin, resulting in smoother, firmer, and rejuvenated skin. The motorized technology of the MD Needle Pen has the ability to adjust the sterile needles to depths ranging from 0.25 to 2.5 millimeters. These variable depths allow for the treatment of deep wrinkles and acne scars, in addition to delicate areas around the lips and eyes. Microneedling is an effective treatment for many skin concerns, as we can see by analyzing these real-life before and after photos. Before treatment, observe that the acne scars are very deep and pigmented, but after microneedling, the skin is smoother and pigment is diminished. Notice the pronounced smoker's lines here before microneedling. After treatment, the lip lines and wrinkles are minimalized. Here, we see increased skin laxity and rough texture before treatment. Once microneedled, the skin is tighter, firmer, and smoother. See the sun damage and uneven tone in this patient's skin before treatment? After microneedling, pigment is lightened and the skin tone is more even. Notice the brown spots, wrinkles, and skin texture before treatment. After microneedle therapy, aging skin is less crepey with reduced dark spots. Before treatment, we see stretch marks that are very dark and highly visible. After needling, they are smoother and the color is less prominent. Before treatment, there is a noticeable shortage of hairs on the scalp. After skin needling, the number of hair follicles is dramatically increased. Clinical studies have shown microneedling as a safe and effective alternative to ablative laser treatments. With no thermal injury to the skin, a short healing time, and the ability to treat any skin type, it is a skin transformative procedure for every person. Clinical specialists designed the MD Needle Pen with durable stainless steel outer shell for reliability and gave it the ability to be used corded or cordless for flexibility. The surgical-grade stainless steel needles are individually sterilized for patient safety and comfort. MD Needle Pen is committed to patient results and has developed unique advanced protocols from actual in-office procedures. To learn even more, we have a clinical study underway with Shriners Hospital for Children for the treatment of hypertrophic burn scars. Microneedling is a safe and effective skin rejuvenating procedure that uses the body's natural cellular regeneration to stimulate collagen production. If you are interested in this unique anti-aging treatment that tightens, lifts, and smooths the skin, visit us at mdneedlepen.com or contact one of our local practitioners.
What I'm going to show you is how to manage small lips as well as a patient.
Okay. The last video that we are going to watch this evening is over the Perfect Derma Peel. So after this video, you are officially allowed to order the Perfect Derma Peel, and you can also do it on yourself. I actually recommend that you do it on yourself. I did one about 2 weeks ago on me, and it is incredible. You peel like a snake, so it definitely gets rid of all those little fine lines and wrinkles and age spots. So I absolutely love it. And you will peel. So it's not a little peel.
Welcome to the Bella Medical Products training video. In this video presentation, you will meet some of our corporate staff, receive additional product information, hear testimonials, and view demonstrations of the Perfect Derma Peel application. Founded in 2011, Bella Medical Products is dedicated to formulating innovative, result-oriented skin solutions for the aesthetic medical industry. Ranked as one of the top 3 new anti-aging products of 2011 by ABC News, the Perfect Derma Peel delivers healthy, ageless skin for all skin types and ethnicities. Bella Medical Products advocates the practice of less invasive cosmetic treatments by providing cutting-edge products to plastic surgeons, dermatologists, cosmetic physicians, and other medical professionals. The Perfect Derma Peel and the Perfect Skincare System product line allow us to offer an exciting new future for skin transformation.
The Perfect Derma Peel is my go-to peel for all of my clients because of its versatility for all skin types and skin issues. I love how the Perfect Derma Peel has little discomfort, and with such little downtime, the results are dramatic.
My clients have benefited from the Perfect Derma Peel for several years now. Applying the Perfect Derma Peel is very easy, and our patients are thrilled with the results.
The Perfect Derma Peel by Bella Medical Products is committed to providing skincare products that deliver superior results to the aesthetic medical community. The Perfect Derma Peel is a safe and effective treatment for aging skin and is the only peel to feature glutathione, an antioxidant with powerful anti-aging benefits. The Perfect Derma Peel is available throughout the U.S. and is growing in popularity worldwide.
Hi, my name is Lana Petrovic. I'm the Director of Operations for Bella Medical Products, and I'm going to explain to you some of the benefits of the Perfect Derma Peel. The Perfect Derma Peel will improve the overall clarity, tone, and texture of the skin, reduce or eliminate hyperpigmentation and melasma, control acne, remove or reduce sun damage, soften fine lines and wrinkles, and minimize the appearance of pores. The Perfect Derma Peel is beneficial for all skin types and all ethnicities.
I feel very comfortable using the Perfect Derma Peel because it's very safe, and at the same time it's very effective, very result oriented.
The Perfect Derma Peel is one of the easiest peels I've ever performed. I've been giving peels for 20+ years in this business. It's 1, 2, 3 easy. It's a half-hour process. They're fairly comfortable throughout the entire procedure. It's great. They're up, they're gone, they're fine. They absolutely love the result. It's a great thing to do when you're preparing to go on a vacation or a wedding. Anytime you want your skin just to look flawless, they absolutely love the Perfect Derma Peel.
Hi, I'm Michelle Ray with Bella Medical Products. The Perfect Derma Peel is a medium-depth medical-grade peel featuring a unique blend of acids that address many common skin concerns. The peel contains TCA, retinoic, salicylic, and kojic acids, phenol, vitamin C, and antioxidant glutathione. Each acid is under 12%, and the peel is pre-mixed for easy application.
I really enjoy working with Bella Medical because the customer service is amazing. I mean, I've never had any issues. It arrives on time, the product is consistent, and they're really easy to work with.
I am Nafis Sabai, the founder and CEO of Bella Medical Products. We are committed to providing skincare products that deliver superior results to the aesthetic medical industry. We are happy to welcome you as a provider of the Perfect Derma Peel.
Hello, my name is Juliana Wagner. I am a licensed esthetician of 20 years, and I'm also the senior trainer for Bella Medical Products, and we're here to do the Perfect Derma Peel today. So Natalie has concerns with fine lines and wrinkles, so we're going to do the Perfect Derma Peel on her today to bring back that healthy glow to the skin. So what we prep the skin with prior to the peel is 100% pure acetone. It degreases the skin so that the peel gets down into the skin evenly and deeper into the skin as well. I'm going to have you hold your breath and tuck your lips, please. Any areas of concern, such as fine lines and wrinkles, as well as hyperpigmented spots, deeper lines, you want to be more aggressive with your acetone in those areas, again, to get that peel down in there to do a better job. A good 2 to 3 passes is necessary. Next, we're going to go ahead and put the peel into the cup here. And you're going to want to apply it with one of the 2x2s that come with the peel. And you're going to fold it into a little bit of the square. In our first pass, we're going to go lightly just to numb the skin. How are you feeling, Natalie?
I'm good.
Good. So the active ingredients in the Perfect Derma Peel is the TCA, salicylic, retinoic acid, vitamin C, glutathione, kojic acid.
It's kind of tickle.
And with the phenol in there, you don't have to have the pain. We're going to feather into the neck 1 to 2 layers, and directly underneath the eye 1 to 2 layers as well. I'm going to have you look up towards me, please. And go ahead and close and relax. You're going to layer the peel till it's gone. You're going to look for frosting as your end point, as well as erythema. You want to redip often into the cup so that it stays nice and even throughout the peel. I'm going to have you look up towards me, please. And that'll be the last layer underneath the eye as well into the neck. And then we'll finish the peel throughout the rest of the face. Almost done here. And you just want to work it through once your cup is empty till your gauze is practically dry. And that's it. As simple as that. So next, we're going to go ahead and go over the post-peel kit with Natalie. Natalie, the peel is supposed to be left on in 6 hours. It self-neutralizes. So you can wash your skin in 6 hours, but preferably I'd like you to go ahead and leave it on overnight if you're not uncomfortable in any way. In the morning, I'll have you wash with a very mild cleanser, and then you're going to go ahead and I'm going to recommend that you take one of the 2 towelettes that are in your post kit. I'm going to hand you the directions as well. And this is a towelette that you're going to use on clean, dry skin tomorrow morning. And this has vitamin A, so it's going to help to expedite the peeling process. So we'll go ahead and you'll use the towelette fairly aggressively. You're going to rub throughout, make sure you get under the eyes really well, and also feather it into the neck. You're going to go ahead and wait at least 30 minutes before applying any sunblock on top. And then you're free to wear makeup that day if you choose. Then that evening, I'm going to have you go ahead and I'm going to have you cleanse again with something mild again, and then go ahead and use your second towelette, and again very aggressively you want to rub it throughout the face, feather it into the neck and under the eyes, and then just go ahead and sleep with that on overnight. Okay? Then after that, the next day you're going to start to see that you're going to start to peel around the mouth. And that's where we talk and move our skin the most, so it'll peel first and then it's going to kind of just slowly peel out for you. So during that process you're going to use the hydrocortisone 1% cream that's in the kit as well. And that's all you'll need along with your sunblock. Okay, and then it is a 7-day process, and then you're going to just look beautiful and glowing as you naturally are.
Thank you so much.
All right, thank you. Prior to the application of the Perfect Derma Peel, it's important to go over the contraindications with your patients. Contraindications include pregnancy, breastfeeding, Accutane use within the last 12 months, hypersensitivity to any of the peel ingredients, or aspirin allergy. Do not apply to skin that is still irritated from any harsh treatments such as lasers, waxing, electrolysis, or chemical exfoliants. Do not apply to open wounds, sunburn, infected skin, cold sores, herpes, or lesions. It is important to advise patients with a history of cold sores to be given an antiviral prior to the peel. For overall rejuvenation, we recommend doing the peel no more than 2 to 4 times per year. However, for chronic conditions such as acne, hyperpigmentation, melasma, and concerns with fine lines and wrinkles, we do recommend a series of 3 peels 30 days apart. For thicker and more resilient skin types, melasma, and acne scarring, we recommend adding the Perfect Derma Plus Booster to the peel solution for optimal results. The peeling process will vary per person based on skin type and skin condition. The peeling process will start within 48 hours, intense peeling for 2 to 3 days, and an additional 2 days remaining with the residual around the hairline and neck areas.
If you have any additional questions or need more information, please feel free to contact your local sales rep or
Okay. Any questions about the Perfect Derma Peel? Perfect. Moving on. All right. So adding on to kind of what Shelly went over for marketing, here's some additional marketing things that we always kind of recommend people to kind of think about. And that's to, follow up with salons about doing a salon partnership, post before and after photos. You can kind of do the math on it and it's under $50. You can make your own graphics for that. You can also post education posts. The one that I had talked about on here was education post about the benefits of the Perfect Derma Peel and microneedling. Also, My Face Lady does have some graphics for you as well. We're currently working on a folder for all of those graphics. That way y'all can just kind of continuously grab them. Anything that we post online through the Instagram page, any of those graphics are free to y'all to grab. Also, I always kind of talk about adding more tools to your toolbox. And this can really be done by following different people on social media. There's so many different educators out there that are free education. I really tell everyone to kind of be a sponge. I taught you in training one way to skin a cat. There are a million different ways to do it. And the only way that you're going to learn all those additional ways is just by listening to other people talk and watching what they do. And that way you can kind of determine the type of aesthetic injector that you want to be. Here are some additional ones. I said, like, you could examples, join a networking group, more education posts, before and after photos. And then I added more social media people that I really enjoy. There's one person on here, Jessie Lee. She's actually a podcaster. She died a couple of years ago from cancer, but she was more just general business. She is more focused on the multi-level marketing side of of a business, but everything that she has to say, I think it really goes along with really an aesthetic injector and just kind of getting comfortable with being uncomfortable and putting yourself out there and how to be successful in this business. Warning, she does cuss a lot, so don't listen to her if you have little children around. The very last thing that we're going to go over is MFL memberships and how you do it. It's very simple to do. So you're going to search for your patient's name. Once you find your patient's name, whoops, sorry. Once you find your patient's name, you can then add their membership directly from their profile. Oh my goodness gracious, why does it keep doing that? You're going to hit these little 3 blue dots at the top and click on membership, and then click on add new, and simply fill out all of the information, including your name and the patient's credit card information, and it will automatically start subtracting the $49.99 a month. Just know that the $49.99 every single month does go 100% to all of their services. It does expire every 12 rolling months. And that is it for today. And stop screen share. I know it's a little bit of a longer call, so I apologize. There was a lot to cover today, but what questions do y'all have for me?
I do have one question. I have my launch coming up on November 1st, and I have several people that are going to come. They've given me their word. But how do I schedule them all for the same time? Or do I need to just do like a 105, 110? Should I do that?
I mean, really, however you want. I mean, just because you schedule someone at a certain time on AR doesn't mean it has to be at that exact time.
Okay.
They're actually scheduled within 15-minute windows. So, I mean, if you want to do that, you absolutely can. If you want to book someone at the same time as somebody else within aesthetic record, there is a button that you have to click that says allow double booking per time. So
Okay.
But yeah, I would book them 15 minutes apart if you're wanting professional opinion.
So realistically, for our first launch party, we should probably do every 15 minutes.
I would. Just also, it doesn't overwhelm you as well, because there's going to be a lot going on, especially for novice injectors. Like when all of these people kind of show up at one time and everyone's kind of standing there, it's kind of like, oh my gosh, now what? So if people are just kind of trickling in every 15 minutes or so, it puts you at ease, even though your onboarding specialist either might be there in person or virtually, or if you're electing to not, it will kind of give you time to take a deep breath.
Okay. So how many people would like a typical launch party include?
So, it really depends. I have been to, for a physical launch or for a physical onboarding specialist to be there, you have to have at least 3 patients in order for a physical person to be there. If you want to do a virtual, obviously it can be 1 patient if you wanted to. I have seen launch parties that are anywhere from, 3. Obviously, I had one that she had 12 patients at a launch party, and it was a lot.
So right now I have 10 scheduled in a 4-hour period, and I'm kind of nervous. Like if I said, oh, well, bring a family or bring a friend if you want, is that unrealistic?
It's not, because life happens. So when 10 people say that they are confirmed, expect for like 40% of them, life will happen and won't come. So just kind of mentally prepared. If that doesn't happen, excellent, but just don't get down on yourself. It does happen, because traditionally that's kind of what we see. And you can always extend it. Is it at your house?
Yes.
Yeah. So, I mean, you're not going anywhere.
Yeah.
Any other questions that y'all have for me?
Yeah, I think someone asked this on the Facebook group, but I didn't see an answer. Are we allowed to self-inject before our launch party?
Yes, you are.
Okay, awesome. Thought I had another question, but I'm blanking now. But yeah, that's it.
So what I would do, because you're going to request your product, and it should be a couple of days, maybe like a day or so before, actually, maybe 2 days, depending on what day your party's on.
Okay.
I would just do it like the day before or something, as long as you're comfortable doing it.
Okay.
Oh, that was my question. If we're doing a launch party, how much product do we need to request beforehand if we're not really quite sure like how many areas they want at their face?
So rule of thumb is 1 bottle is 3 people in general, right? Because some patients will be like, I just want a lip flip. And then you'll have some, they'll be like, freeze my face, my full face. So I usually say 1 bottle per 3 people. And then that should keep you pretty safe. So if you're having 10, confirmed patients, just kind of mentally prepare for that. But then also your onboarding specialist might bring some product as well. Are you having an in-person launch or is it
They can't make it, so I'm just
virtual?
Going for it.
Yeah. Is it going to be a virtual or is it just on your own?
Just on my own.
Okay, if you want me to be on virtually, I will.
Okay, thank you.
Yeah, so just let me know. You have my cell phone number, so just text me and I just sit on a video and sit and watch the outside of me slapping your hand. It's like I'm there.
Yeah.
So at least for your first patient, if you want me to, I will.
Thank you.
Yeah.
I do have, oh, sorry, go ahead.
Sorry. I don't know if I've completely missed this. Can you just go over how we order the product? I don't know. Yeah.
Great question. So there's an order form. If you go on to your onboarding page or the MFL only page and type in order form, there's a link that you can actually click and the entire order form will be there. It's also on Bamboo for you as well.
Okay.
Yep.
And then is there a deadline in like setting up the launch party? I've just kind of like
not at all.
I'm still working full time and I'm literally getting married in like a month and I'm like super overwhelmed. Yeah, so I'm kind of like freaking out because I have like a million things that I'm doing. But
no, there's absolutely no timeline. It is your own timeline. So there's, we're not going to be like you have 2 weeks to do this. It's definitely on your own time.
Okay. Perfect.
Yeah.
And I have one quick question also, and I don't know if I remember seeing it in any of the online stuff, training stuff, but I have one person who is wanting to do tox and also the chemical peel. Is it possible to do both? Do we do the tox first and then the chemical peel?
Great question. You do chemical peel first and then tox.
Okay. Okay.
And the reason for that is because with the chemical peel, you're rubbing, you saw it like all over the patient's face, and you don't want to accidentally move the product after you've injected it.
Gotcha. Okay. Sounds good.
Peel first.
Okay.
And then to piggyback on that, can you do microneedling and Botox?
Yes, same thing. Microneedle first, and then tox.
Gotcha. And then in general, how far in advance do you need to order your product for before appointments?
It really depends. I always have tox on me, just because I see patients constantly. And so what we don't want is you to order, 5 vials of Botox and just sit on it. We want to make sure that we keep it, moving within circulation. I always recommend everyone have at least 1 bottle of tox on them. Just for those emergency patients, I will say I have never, ever, ever in the 10 years I've been injecting, ever lost a patient. If someone says, hey, can you see me right this second or tomorrow? And I say no, because I don't have product for whatever reason. But I can see you the next day. I can absolutely order, especially if you're in a big city. We can get it to you same day if we absolutely have to.
So like the peels and the microneedling pen, like 2 days, 3 days, like how?
Yeah, the peel is super fast. The pen's a little bit trickier just because we don't have so many of them floating around the big cities. And so we usually recommend 2 business days for that.
Okay, so pretty quick.
Yeah.
Has anybody ever actually purchased like the pen themselves? Is it like something like crazy expensive where?
No, great question. So actually, I reached out to the manufacturer and I am working on getting a microsite set up for us because several injectors have asked if they can purchase their own pen. Someone was like, hey, I have a pen, can I use it? We do have to make sure that we're using the same company and it's the same quality. So that's the reason why we're not allowing injectors to use outside pens. We only want them to use MD Needle pen, but we do have several that have asked about it. So hold tight on that and I will get an answer to you. I'm hoping the next 2 weeks because it'll be a discount to us.
Okay.
They're about $1,000 resale. So just kind of keep that in mind.
Oh.
Okay. Yeah. I was wondering a ballpark price.
Yeah.
I had a question about the promo that they do the second Wednesday of every month, the toxin. So is that something that they would buy on the second Wednesday, but you don't have to get injected on that day?
No, you have to be injected that day.
Okay. So they have to schedule on that day.
Correct. Yes. And the
It's
reason
not
why we
something
did
you can
that.
buy in advance.
Correct. The reason why we did that is because Wednesdays are traditionally a slow tox day. So it's a way to get injectors, busier during the week than on the weekends. That was
So we have to be available that day.
correct. Yes. Because we had some injectors that are like, I am slammed on the weekend and I want to have some more business during the week. What can we do? And that's what we came up with.
So there's no option to bank like.
No,
anything.
unfortunately. Yeah.
Thank you.
At least as of right now, I should say that.
And one more thing. Does the party pricing for like the 10% off, does that apply to filler or is that just
Everything?
toxin?
Everything.
Okay.
Everything except weight
All
loss.
of it?
Yep.
Okay.
Yep. Just not weight loss. And then speaking of weight loss, a reminder that all NPs and PAs can offer weight loss as an independent provider, and then registered nurses, y'all can also offer weight loss to your patients, but it looks a little different for y'all. What is going to be happening with the registered nurses? There's a video that you can watch in education. How you get compensated for this is basically doing the intake form, and then you will schedule the patient. Currently, I'm the only APC provider doing the registered nurses weight loss patients. Once I get super busy, what will happen is then I will open up to other APCs. But currently, I see patients every Tuesday and Thursday for weight loss.
How do we get the weight loss order form?
It's online.
Bamboo?
It's on the Facebook group right now. There is a video that says RN weight management. And so when you watch it, it's education because there's some education that y'all have to do. It's over the semaglutide and tirzepatide. It's basically the same education that the providers that we have to take, just because we're prescribing the meds, y'all need to know it as well. So you know how to talk to your patients.
I'm not sure somebody asked this before, but pricing, like how are we presenting or should we present pricing? Like how, I know obviously we can't, post the one graphic with like all the prices.
So so when we say we don't want you to post that one graphic, it's just that one large graphic. You are more than welcome to make one that says Botox as low as whatever, as low as $9.50 a unit or Daxxify or whatever the price is. You absolutely can do that. It's just that one graphic. It has everything on it, and that could potentially change. Like one thing on there might change, and then some people might get confused. So, but if you want to make something that says, Daxxify $10 a unit, knock yourself out.
Is there an updated graphic that has exactly how much, like if somebody asks?
Yeah, on the MFL injector only page, the price list is on there. Yeah, and it's like a big, it's kind of hard to see because you have to like zoom in, but it's basically every single price list, and it's not super pretty either. So that's the reason why we also don't want you to post it. I mean, it's not ugly, but.
Thank you.
Yeah. Alrighty. Well, I will let y'all enjoy the rest of your Sunday evening. We have one more week left. And so next week, it will be a lot shorter. It's just going to be going over some education stuff and then final wrap up questions. And then you will be off to the races after that. Well, if anyone has any other questions, I will stay on just for a little bit longer, but I'm going to go ahead and stop the recording.